Hello, Miss Sink. This is Hannah Jessup, and today I'll be discussing how to take care of your oral health. So we'll discuss a bunch of things. First, I want to talk about your dentures and your partial. And the first thing I need to know, and I need you to ask yourself, is does your denture and partial fit correctly? Are they loose? Do they rub against your gums? And is it hard to eat with them? Do they flop around? If you answered yes to any of those questions, then you really need to go see a dentist as soon as possible to get refitted for a new one. The problem with a denture or partial that doesn't fit correctly is it can cause a cacophony of problems. It can cause sores, it can cause pain in your temporomandibular joint. Some people think they have an ear infection, but it's actually the TMJ joint. It can increase your chance of infection because of those sores, and you're diabetic. So on top of that, it's really not a good thing. It can cause problems eating, trouble speaking, and it increases your chance of candidiasis or a yeast infection as well. Okay, now that we've discussed whether or not your denture and partial fit, we can discuss giving your mouth a break. It's really important that you remove both your denture and partial for a few hours every day or overnight. I know you remove yours at night, which is perfect. And every time you remove it, you need to clean it, and you need to clean it with its own brush, a soft bristle brush, or using a denture brush like I'm going to give you. When you do store your denture overnight, you need to make sure that you use warm to room temperature water, never hot. And you can use water or you can use the denture cleaner. I'm going to give you some denture cleaner, and I'll show you a video on how to do that. Okay, so when you soak your denture, you want to fill the bottom of the sink with some paper towels or a towel and then put some water in it. That way when you take your denture out, if it falls, it just is falling on a thing of water and paper towels or towel, so it won't break. Then you want to fill a cup of water with warm water, not hot. It can be room temperature, that's fine. But since we're using this Polydent, which I'll show you, it's really great. And on the instructions on the back, it says drop 1 Polydent cleanser tablet into enough very warm, not hot water to cover the denture or partial. So you just want to grab you 1 tablet out, and there it goes. And you want to just pop that into there. And then you could put your denture in there. I'd give it a second to fizz up. And there you have it. Then it's ready for your denture and partial. Just put them in there. And with this stuff, just don't put it in your mouth. You don't want to put this Polydent in your mouth. It's a cleaner. Okay, so with this denture cleaner Polydent, you want to make sure it says on the back, you need to soak it for 3 to 5 minutes for best results. So you just want to make sure to soak it real good. And once you're done, it says you can brush denture with solution using a soft bristle brush. You can also use this denture brush I'm going to give you. It's really great. And it has a bigger handle, so I think it'll be easier for you to use. You just want to soak it there and scrub it really good. And just get all the sides. Now the smaller end of the brush you can use for that groove where your teeth go, or where your gum line is. My model here doesn't have it, so you just have to use your imagination. And you can use this little rubber tip on the other end to really get in between those teeth in case you got something stuck there. It can safely scrape it out without scratching your denture. And then you want to rinse the denture and partial thoroughly with running water. And I would just leave the towels or the paper towels with the water in the bottom of your sink while you're doing this, just in case you drop it, it won't break. And you just want to make sure you get all this cleaner off of it before you put it in your mouth. And there you have it. I'm not going to show you how to clean the other one because you get the idea. So now we need to discuss cleaning the mouth out. Once the denture and partial are removed, you still need to take care of the teeth that you have, so you need to brush those. And you need to take care of where the partial and denture sit. So you can get a gauze, a 2x2 gauze, or a soft bristle brush and very gently wipe over where those denture and partial sit. And you want to make sure you brush your teeth thoroughly and floss. So now we're going to talk about dexterity. Do you ever feel like it's difficult to brush your teeth? I know that you have osteoarthritis pretty bad in your hands, but it's pretty common. 27 million Americans have osteoarthritis, and honestly, it's probably more than that. Those are just the recorded cases, and most of those, of course, are over the age of 60. So it's a really common occurrence, but it can really affect your day-to-day life. So I'm going to go over some dexterity aids, which I think could really help you with not only brushing your teeth, but you could use these for other things too. Like if you need to write, you could get some of these dexterity aids and put over a pencil or pen. So there are a couple of dexterity aids out there. I'm just going to discuss a few when it comes to brushing your teeth. You can use a tennis ball with a hole in it. That's pretty easy to get. I'm going to show you how to use the Grip Easy. I like the Grip Easy. It's easy to clean. It's reusable. So when it's time to change out your toothbrush, you can just get a new one and wipe down the Grip Easy and pop it in there. You can also use children brushes. They have larger handles. They're easier to grip. Electric toothbrushes are bigger, have bigger bases, so they're quite easy to grip. And I'm also going to show you a floss holding device with the Grip Easy. Floss holding devices are longer. The handles tend to be a bit bigger than just using floss. Floss alone can be really hard for those with arthritis in their hands. So I'll show you how to use those as well. Okay, so I'm going to show you how to use the Grip Easy with a toothbrush. You still want to brush your teeth 2 times a day for 2 minutes. Well, for 2 minutes, I would say 2 minutes should take up brushing your partial and your denture and brushing your teeth. It probably will take you a little longer, actually. So you just pop in your toothbrush with the Grip Easy, and then you just want to gently, you want to barely touch your gums, and just gently back and forth motions and get all your teeth. I'm just going to show you the bottom front teeth because those are the ones you have. And then you want to go back around and just do a motion up like that, a rolling motion, a couple of times. And then you want to make sure you get the tops of your teeth. And just with that gentle back and forth motion. And you can go slower than I did. And just, it might be easier to turn your handle like this to get those bottom front teeth. But same back and forth slow motion. And then a rolling motion, you can do it this way. And there you have it. The Grip Easy makes it a nice, long, big handle for you to hold on to. I think it'll help you a lot. So next I'm going to show you how to floss your teeth with this floss holding device. So I like this Listerine floss holder. It has a long handle. It's easy to put into the Grip Easy like this. And it has interchangeable heads, which is really nice. I think it's easier to change out the heads than trying to wrap floss around a normal floss holding device. So you just want to, like this, just go gently do a seesaw in motion in between each of those teeth. And do your best to hug the teeth. I know it's a little bit difficult with these flossers. But you want to try to make a C motion around the tooth. like you're hugging it, and just slightly go under the gums very gently. You don't want to force it. And just pull back up. But I like these flossers because you can just put it in the grip easy and it's a lot easier to use. Okay, so oral cancer. I'm going to show you some videos on how to check for oral cancer and head and neck cancer. It's still important to go to your dentist regularly and get checked for that. And I'm going to give you a brochure that goes into more detail about oral cancer, but I will go over some basics here. So what you're looking for a red, white, or red and white lesion, any sore or ulcer that has not healed in 2 weeks, swelling that lasts 3 weeks, lumps or thickening areas. When you feel something, if it's hard and immobile, you want to go talk to your doctor about that. Don't panic. Might not be cancer. Chances are it's not cancer, but better safe than sorry. Pain when you're swallowing, or if you feel like something's just stuck in the back of your throat and it won't go away. A jaw pain or stiffness, sensation of something stuck back in their throat. Ill-fitting dentures, like if your denture fit one day and now it's starting to feel tight. Maybe there's a lump there that wasn't there before, so you want to be careful with that. Another reason to go to your dentist if the denture's not fitting right. If your tongue is just hurting, it's good to get that checked out as well. So every time you take your denture and partial out, you want to just take a moment to check the inside of your mouth. You're looking again for those red and white lesions, and you're going to feel your lips, and you're feeling for anything hard and that won't move around when you rub it. But you want to pull both your cheeks back and just take a good look at the sides. You can use your toothbrush to kind of push the cheeks back and look around your gums. And you want to look at the sides and the back of your tongue. Again, you can use that toothbrush to look kind of further back. You want to try to look at the top of your mouth for any lesions and look at the back of your throat. And you can use that brush again to kind of depress your tongue. You want to push down on the floor of your mouth and push up under your chin. You're feeling again for any lumps or bumps that are immobile. You also want to check the back of your head and neck area. So you're just going to feel kind of crawling finger motion on the back of your head. You will go around, just carefully feeling for any lumps. You'll go all the way towards your ears, the back of your ears. And once you've done that, you can turn around and you're going to just feel your face, just your forehead. We're going to go down with that same kind of crawling, pushing motion and just feel everything. Then you want to try and feel the front of your chin too. Just really kind of push there. And then you want to get up under your chin. Sorry, sister walked in on me. So you want to get up under your jawline and your chin, and you want to just kind of grab towards the middle of your neck area there and just kind of push it forward, kind of roll it with your finger. And you're just feeling again for any kind of lump that's not wanting or hard, immobile thing, that nodule there. And you just want to do both sides. And then you want to feel your thyroid, just swallow, make sure it's even, not swollen on one side. And then you want to kind of turn your head to one side and just use your thumb and your fingers to kind of squeeze and crawl down that muscle there. You should be able to feel it if you turn your head all the way to the side. There's a muscle that kind of sticks out a little bit. And you're just feeling down to the base. So now we're going to discuss how often you should do these oral screening checks. So you can give yourself an oral cancer screening and just check like I showed you every night when you take your denture and partial out. And every time on a yearly basis. Every year you need to see your dentist and have them do a cancer screening on you. It's real easy, doesn't take long, isn't that invasive. They just kind of shine a light and look for anything suspicious. So let's say that your denture and partial don't quite fit right. You can't afford a new one right yet. You're saving some money. Until then, you can use this Poligrip. It's really great stuff. You can use it anyway just to make secure your denture and partial in place, keep it from being loose. So you want to clean and dry your denture, apply the Poligrip to the ridges that are naturally in your denture and partial. Rinse your mouth before inserting the denture. Press the denture in place and hold firmly and bite down for a few seconds to secure it. When you're ready to remove your denture, you want to swish your mouth with water. Slowly remove your denture and partial with a rocking motion. And then you can remove the adhesive residue from the denture and mouth with warm water and a soft brush, or with a denture brush on your denture and partial. Hello. So we've discussed a lot, so I'm just going to review what we've talked about. First, we talked about the importance of denture fitting in your mouth. You don't want a loose denture or partial. You don't want it to rub, and you don't want it to get in the way when you eat. It shouldn't be flopping around in there. So you can use the denture adhesives to help it stay, but if a denture doesn't fit, you really need to just go talk to your dentist about getting it refitted or get a new one. A denture is supposed to last about 10 years. So I know you've had yours for a while, so it might be, if it feels loose, and I know you've mentioned it being a bit loose, it might be time to go get a new one. You don't want a denture or partial being loose and rubbing against those soft tissues in your mouth. It can cause sores, and it increases your chance of oral cancer. You're diabetic, so having an open sore is even worse. I know you understand that. And it can cause increased chance of infections. So make sure that your denture and partial fit correctly and aren't loose. We also talked about removing your denture and partial. You want to remove it overnight, and you want to make sure you store it properly. You want to make sure you remove your partial and denture for a couple hours every day or at night to give your tissues a break and let them have some air. So to store your denture, you want to keep it in room temperature to warm water, never hot. You can leave it in a denture cleaner too, that's great. And when you clean your denture, you want to put some paper towels or a towel in the bottom of a sink, and you want to fill it with some water. That way if the denture and partial fall in the sink, they won't break. They'll just hit some paper towels and water. So you want to clean your denture with its own brush, either a soft bristle brush or a denture brush, like the one I gave you. And you want to make sure when you remove your dentures and your partial that you clean it every time. And you want to make sure you clean the inside of your mouth as well, even where you don't have any teeth. Just get a soft bristle brush or a 2x2 gauze and just wipe it around in there and make sure everything's nice and clean. And make sure to brush your teeth too, with the method that I showed you in the video, and to floss as well. You want to keep what's left. And if it's difficult, I know you have bad osteoarthritis. If it's difficult, you can use that Grip Easy I gave you, or a tennis ball, or you can use a child's toothbrush. They have larger handles, they're easier to grip. A power or an electric toothbrush is a lot easier to grip. You can use that, whatever you want to use on the end of your brush. I like the Grip Easy because you can put multiple things in there, so you can switch it out with your denture or with the floss holder, which is also nicer because it's a longer handle. So I think that'll be easier for you. And then when you have your denture and partial removed, it'd be good to do an oral cancer screen check like I showed you, and make sure you just look at the sides of your tongue, under your tongue, roof of your mouth, back of your throat. You're looking for a red or white lesion, any kind of ulcer or sore that hasn't healed in 2 weeks, or if it feels like you have something caught in the back of your throat, then you need to talk to your doctor. Don't panic. It might not be oral cancer, but it's good just to be safe. Better safe than sorry. You want to check the outside of your mouth and around your face and head, and you're looking for anything hard and immovable. But again, don't panic if you feel it. Just go talk to your doctor or a dentist. So let's see. And you want to check every time you remove it, at least once a week. Do an oral cancer check just to be aware of what's going on in there, so you know what's normal and what's not normal. And every time you go to the dentist, at least once a year, have them do an oral screening on you just to be safe. Better safe than sorry. Thanks so much for watching.